Health disorders. Stress. Stress is a general term for the physical and psychological symptoms people experience when they feel overwhelmed in stressful situations. Levels of the hormones epinephrine and hydrocortisone increase, raising the heart rate and blood pressure and altering the metabolism to improve performance. However, high levels of these hormones long term can have a negative effect, producing symptoms such as headaches, sleeping problems, palpitations, eating too much or too little, irritability, difficulty concentrating and making decisions. Anxiety and depression. Stress can often be managed by self-help measures such as relaxation techniques, regular exercise, and eating healthily. If such measures are ineffective, treatment options include psychotherapy and medications for specific problems such as antidepressants or sleeping pills. Anxiety disorders. Generalized anxiety disorder, panic disorder, temporarily anxiety in stressful situations is natural, but when it becomes a general response to ordinary situations and causes problems in coping with everyday life, it is considered a disorder. The main types of anxiety disorder are generalized anxiety disorder, panic disorder, phobias, and post-traumatic stress disorder. In generalized anxiety disorder, there are persistent psychological symptoms such as a sense of foreboding with no apparent cause, being on edge, impaired concentration, repetitive worrying thoughts, disturbed sleep, and sometimes depression. The physical symptoms of generalized anxiety disorder tend to occur intermittently. They may include headache, abdominal cramps, diarrhea, vomiting, sweating, frequent urination, and trembling. In panic disorder, psychological and physical symptoms develop suddenly and unpredictably. They may include breathlessness, sweating, trembling, nausea, palpitations, dizziness, fainting, and a feeling of choking, a sense of unreality, and a fear that death may be imminent. Treatment of anxiety disorders usually involves psychotherapy, for example, cognitive behavioral therapy, CBT, and medications to relieve symptoms such as antidepressants or, in some cases, a short-term course of anti-anxiety drugs. Self-help measures such as relaxation techniques may also help to reduce anxiety levels. Alright, so phobias. A phobia is a persistent, overwhelming fear of a particular object, animal, activity, or situation. Exposure to the object of the phobia leads to intense anxiety accompanied by symptoms such as dizziness, palpitations, sweating, trembling, and breathlessness. A person with a phobia has such a compelling desire to avoid the source of the phobia that it interferes with normal life. Most phobias can be successfully treated with desensitization therapy, which involves gradual exposure to the source of the phobia. Psychotherapy or counseling. Anti-anxiety medication may also be prescribed in some cases. Arachnophobia. Fear of spiders is a common phobia. In extreme cases, even thinking about or seeing an image of a spider can trigger a phobic reaction. Post-traumatic stress disorder. Post-traumatic stress disorder, PTSD, is a form of anxiety that develops after a very distressing, frightening, or stressful event, such as a natural disaster, serious accident, assault, or military combat. Symptoms may occur soon after the event or not for months or rarely years later. They may include involuntary thoughts or flashbacks of the event, nightmares, insomnia, and panic attacks with the symptoms such as trembling, sweating, breathlessness, palpitations, and lightheadedness. There may also be avoidance of reminders of the event and refusal to talk about it. Irritability and emotional numbness. PTSD may also lead to problems such as depression or alcohol or drug abuse. In some cases, PTSD clears up without treatment. If it lasts for more than about a month, psychotherapy, antidepressants, or both may be recommended. Psychosis. Psychosis is a mental problem in which the person's thoughts are so disturbed that he or she loses touch with reality. The main features are hallucinations such as hearing voices and delusions such as believing that people are trying to harm you. Hallucinations and delusions can in turn lead to disorganized thinking and speech. With racing thoughts, difficulty in keeping with mental focus, and incoherent speech, psychosis may be due to a mental health problems such as schizophrenia, bipolar disorder, or severe depression. It may also result from factors such as drug or alcohol abuse or certain brain disorders. Treatment is with antipsychotic medications and psychotherapy, together with treatment of their underlying cause. Bipolar disorder, formerly known as manic depression. Bipolar disorder is categorized by extreme mood swings between highs, mania, and lows, depression. The underlying cause is unknown, but it is believed to involve chemical abnormalities in the brain. Genetic factors may also be involved because the disorder is sometimes runs in the families. Typically, symptoms of mania and depression alternate, with normal periods in between. Symptoms of a manic episode may include elation, inflated self-esteem, which may lead to delusions of wealth, power, or accomplishment, increased energy, poor concentration, loss of inhibitions, and sometimes hallucinations. During a depressive phase, symptoms include everyday low energy, loss of interest in everyday life, feeling of worthlessness, and loss of hope for the future. Treatment is with medication to stabilize moods, often with psychotherapy. In severe cases, hospital treatment may be needed. Bipolar disorder is usually a long-term condition. Brain activity in bipolar disorder. These brain scans show brain activity during normal periods left and increased levels of activity and during manic episode right. Alright. Schizophrenia. Schizophrenia is a serious mental health disorder in which there are distortions in thinking and perceptions with reality. Disturbed emotions, changes in behavior. The cause of the condition is unknown, but genetic factors are known to play a part. A person who is closely related to somebody with schizophrenia has a significantly increased risk of developing the disorder. Additionally, in susceptible people, schizophrenia may be triggered by factors such as stress or drug abuse. Symptoms of schizophrenia are usually developed gradually. They may include hallucinations, irrational beliefs, in particular that thoughts and actions are controlled by an outside force, delusions or persecution, expression of inappropriate emotions. They may also be rambling speech with rapid switching from one topic to another. Disordered thoughts and agitation. A person with schizophrenia may become depressed and socially withdrawn. Treatment is usually with a combination of antipsychotic medication and psychotherapy, together with social support and rehabilitation. In most cases, schizophrenia is a long-term condition. Temporal lobe, frontal lobe. Schizophrenia in the brain. Studies of people with schizophrenia have revealed differences in the brain chemicals and brain structure, such as a reduced amount of gray matter in the frontal and temporal lobes. Insomnia. Nightmares and night terrors. Falling asleep or staying asleep is often due to lifestyle choices. Lifestyle factors such as too much caffeine, a poor sleeping environment, or jet lag. Numerous physical and mental health conditions may also cause insomnia, as can certain medications. Snoring, sleep apnea, nightmares and night terrors, arousal from sleep in a state of fear, can also disrupt sleep. Insomnia can often be improved by self-help measures such as changing bedtime habits and treatment of any underlying medical condition. A doctor may also recommend a type of cognitive behavioral therapy specifically designed for insomnia or prescribe medication to help sleep. Cyclothymia. Cyclothymia is a mid-form of bipolar disorder in which there are similar mood swings, but the highs are not extreme enough to be medically classified as mania, and the lows are not severe enough to be categorized as clinical depression. As with bipolar disorder, there is often a normal period between the highs and the lows. The mood swings occur relatively frequently with no more than 2 symptom-free months in succession. They may also have persisted for at least 2 years for a formal diagnosis of cyclothymia to be made. Treatment is usually with mood stabilizer medications and psychotherapy. In some cases, the condition clears up, but in others, it is long-term or progresses to full-blown bipolar disorder. Alright. Alright, depression, postnatal depression, seasonal affective disorder, SAD. Depression is categorized by persistent feelings of sadness, hopelessness, and loss of interest in life. A number of factors may trigger it, including a stressful life event, such as bereavement, physical illness, or mental health problems, hormonal changes after childbirth, postnatal depression, certain medications, or alcohol or drug abuse. Some people become depressed only during winter months, a condition known as seasonal affective disorder, SAD. Depression may also sometimes run in families. Depression can cause a wide variety of symptoms, and they may vary in severity from person to person. Common symptoms include a feeling of sadness, loss of interest in and enjoyment of work and leisure activities, low energy, anxiety, irritability, and low self-esteem. Other symptoms may include poor concentration, sleeping problems, weight loss or weight gain, reduced sex drive, loss of hope for the future, and thoughts of self-harm or suicide. Mid-depression may improve by itself without medical treatment. In many cases, lifestyle measures may help, such as regular exercise, support from a self-help group, or for SAD-like therapy. If the depression does not improve with such measures, psychotherapy and antidepressant medication may be prescribed. If these treatments are ineffective, transcranial magnetic stimulation, stimulating the brain with magnetic fields, or electroconvulsive therapy passing an electric current through the brain may be recommended. A person who is suicidal or a mother who has thoughts of harming her baby requires prompt medical help. Prefrontal cortex, amygdala, hippocampus, brain areas, and depression. Depression may involve the amygdala and hippocampus, which produce emotional responses, and the prefrontal cortex, which generates thoughts about those emotions. Alright, so personality disorders. Personality disorders are conditions in which rigid, dysfunctional patterns of thought and behavior cause persistent problems relating to others and fitting in with society. They typically emerge in adolescence and continue into adulthood. Personality disorders fall into three main groups. The first comprises paranoid, schizoid, and schizotypical personalities. People in this group have patterns of behavior and thinking that most would see as eccentric or odd. The second group consists of antisocial, histrionic, narcissistic, or borderline personality types. This group is typified by emotional, impulsive, attention-seeking, or self-centered behavior. The third group comprises avoidant, dependent, or obsessive-compulsive personalities. People in this group have anxious, fearful, or inhibited patterns of thinking and behavior. Treatment usually involves psychotherapy and support to help the person adapt to his or her behavior and function successfully. The outlook is variable, although generally the manifestations of a dysfunctional personality diminish with age. Obsessive-compulsive disorder, commonly known as OCD. Obsessive-compulsive disorder is categorized by uncontrollable, persistent thoughts, obsessions accompanied by irresistible urges to carry out particular actions or rituals, compulsions. Obsessions are unwanted thoughts, images, or feelings that enter the mind repeatedly and cause disturbing feelings of anxiety and disgust. A person with OCD may recognize that the obsessions are irrational, but is unable to ignore them. Compulsions are repetitive behaviors or mental acts that the person feels driven to perform to relieve the disturbing feelings caused by the obsession. Compulsive acts, repetitive hand washing, for example, may have carried out so many times that they seriously disrupt normal life. Mid-OCD can often be successfully treated with psychotherapy. In more severe cases, psychotherapy and antidepressant medication may be used. Most people improve within about a year of starting treatment, but for a minority, OCD may persist long-term. ADHD, attention deficit Hyperactivity disorder, ADHD, is a behavioral problem in children in which there is consistently high level of activity, impulsiveness, and difficulty attending to tasks. The cause is unknown. Although the disorder tends to run in families, so a genetic factor may be involved. Symptoms usually develop between about the ages of 3 and 7 years. They may include a short attention span, an inability to finish tasks, difficulty in following instructions, a tendency to talk excessively and interrupt others, difficulty waiting or taking turns, constant fidgeting, and an inability to play quietly alone, and frequently acting without thinking. Treatment may be with therapy, medication, or both. Therapy may involve psychotherapy and social skills training, as well as training and education for parents. Medications can help to control the symptoms, for example, by aiding concentration and reducing impulsiveness. Symptoms of ADHD usually diminish with time, although the condition may sometimes persist into adulthood. Tourette's syndrome. Tourette's syndrome is a nervous system disorder characterized by repetitive involuntary movements and noises, tics. The cause of the condition is unknown, although it often runs in families, so genetic factors may be involved. Symptoms typically begin between the ages of about 7 and 12. They include physical tics, such as facial twitches, blinking, mouth movements, and the head and foot movements, and vocal tics such as coughing, throat clearing, snorting, and grunting. In some cases, the person may repeatedly utter obscenities, copy what the other people say or do, say the same thing repeatedly, or make complex physical movements such as jumping or hitting themselves or others. Treatment is usually with psychotherapy. Medication to control the tics may also be used, but for most people, the condition is lifelong, although the symptoms tend to become less severe with age and may eventually disappear completely. Eating disorders. Anorexia nervosa. Eating disorders are characterized by an abnormal attitude to food, resulting in avoiding food, anorexia, self-induced vomiting, bulimia, or compulsive overeating, binge disorder. People with anorexia believe themselves to be fat even when they are underweight, as well as severely restricting calorie intake. Affected people may exercise excessively, use appetite suppressants or laxatives, or make themselves vomit after eating. Menstrual periods may stop, fine downy hair grows on the body, and the body muscles waste away. Eventually, anorexia can be life-threatening. In bulimia, the person binge eats and then deliberately vomits or uses laxatives to avoid weight gain. Vomiting may cause chemical imbalances in the blood, which may lead to irregular heart rhythms. In binge eating disorder, the person feels compelled to eat large amounts in a short period, even when he or she is not hungry, which often leads to obesity. Treatment of an eating disorder usually involves psychotherapy or nutritional guidance. Antidepressants may also be prescribed. Recovery may take a long time, sometimes years. Acid-worn teeth and bulimia. Recurrent vomiting and bulimia causes the teeth to be exposed repeatedly to stomach acid. This wears away the enamel covering the teeth and may eventually lead to tooth decay. Substance misuse. Alcohol drug misuse. Substance misuse is the harmful use of alcohol drugs, including prescription and over-the-counter medications or other chemicals such as inhalants. Commonly misused substances include alcohol, cannabis, heroin, cocaine, amphetamines, benzodiazepines, hallucinogens, and various designer drugs. Usually they are used to cause intoxication or alter mood. However, excessive amounts can be dangerous in the short term. For example, drinking large amounts of alcohol in a short period may cause confusion, loss of memory, or in extreme cases, death. Similarly, a drug overdose may be fatal in the longer term. Regular use of the substance may lead to tolerance, in which increasing amounts are needed to achieve the desired effect, and addiction. It may also cause organ damage, mental health problems, and disruption of family, social, and work life. Addictions. An addiction is a state of being so dependent on something that it is difficult or impossible to do without it for any significant period. It is possible to become addicted to anything, but whatever the addiction is, the person cannot control it. Some symptoms are specific to the addictive substance or activity, but there are general features that occur in all addictions. These include the development of tolerance, the need for increasing amounts to produce the desired effect, unpleasant physical and psychological symptoms when the substance or activity is stopped, and continue to use the substance or engage in the activity even though may be detrimental. Treatment of addictions depends on the specific substance or activity involved. In general, however, it may include support from family, friends, and self-help groups while reducing use of the substance or the activity. In psychotherapy, medication may also sometimes be prescribed, for example, to reduce withdrawal symptoms in drug and alcohol addiction. In some cases, treatment in the specialist rehabilitation center may be recommended. Oh man, that's not good. In a rehabilitation center? No, I wouldn't say that. That's a good thing. Online gambling. Compulsive gambling can jeopardize many aspects of a person's social, work, family life, as well as causing financial problems. The ability of online gambling may make it harder for a person addicted to gambling to stop.